What is the next thing? Next thing is we are looking at the posterior fossa, some openings and some structures passing through those openings. We got a question. It is asking if there is a mass in jugular foramen. What is not seen? You know, jugular foramen has the number 9, 10, 11. So, supplying the muscles of palate, pharynx, larynx. So they are the muscles for speech and swallowing. So you can understand what will happen. There will be difficulty, speech and swallowing. See, if there is a mass in jugular foramen, the number 9, 10, 11 is involved and muscles of palate, pharynx, larynx compromised. So, difficulty, speech and swallowing. And 11th nerve is two types. One is spinal accessory nerve also passing. So, supply the two muscles, namely sternomastoid and trapezius. So they will also be paralyzed. If you say that spinal accessory nerve, 11th nerve, is also passing the jugular foramen and it's compromised, then sternocleidomastoid trapezius compromised, then you have the basic idea. Now you can tell the answer. See, difficulty, speech and swallowing is due to paralysis of palate, pharynx, larynx muscles supplied by nerve number 9, 10, 11, cranial part of 11. And when the spinal part of 11th is damaged, the sternomastoid will be compromised, so patient cannot turn the head to opposite side. If sternomastoid is paralyzed, patient cannot turn the head to opposite side. So there is no problem. Problem is here. Why? Because this is the problem of 12th nerve. So 12th nerve is hypoglossal nerve in the hypoglossal canal. It is not in the jugular foramen. That's why this is the answer. This is the exception. So you're telling this is the exception because it will not be in the jugular foramen? No. This is 12th nerve, hypoglossal nerve in the hypoglossal canal and not in the jugular foramen. So this is the answer. Okay, keep the answer. Tell me the other details. To discuss the other details, we have to draw a diagram. Let's draw the diagram. Which diagram? We are looking at the posterior cranial fossa and some of the foramina through which some nerves are passing. You already know those nerves, but we are drawing them ourselves to remember better. What is this? This is superior view of cranial cavity again. If you say this is superior view of cranial cavity again, where are you looking at? Posterior cranial fossa having brainstem and brainstem giving cranial nerve number 3 to 12. So we're looking at posterior cranial fossa, brainstem giving down number 3 to 12 here. Yes. Okay. Which nerve you want to follow? I want to follow nerve number 7 to 12. Why? Because they are passing through some foramina in the posterior cranial fossa. So you're telling that this is posterior cranial fossa. You're telling that this is posterior cranial fossa. Yes. In the posterior cranial fossa, you have brainstem giving cranial nerve number 3 to 12 and you want to follow nerve number 7 to 12 which are going to pass through some opening in the posterior cranial fossa. Which opening are you talking about? A large opening, foramen magnum, and some small openings. Name, I'll tell you. This is internal auditory meatus. What is behind that? That is the jugular foramen. What is behind that? That is the hypoglossal canal. What is behind that? The large foramen magnum. So you're telling this is internal auditory meatus in the posterior cranial fossa? Yes. And this is the jugular foramen? Yes. And that is the hypoglossal canal? Yes. And this is the foramen magnum? Yes. Which nerves are passing 7 to 12? You told 7 to 12. Where is 7th nerve passing? 7th nerve. Yes. 7th nerve and 8th nerve are passing here. Where? The nerve number 7 and nerve number 8 are passing in the internal auditory meatus. If you say nerve number 7 and 8 are passing in the internal auditory meatus, fine. Where is the number 9, 10, 11? It is here. 9, 10, 11. If you say nerve number 9, 10, 11 is here, 9, 10, 11 is here, where is 12? 12th is not there. And where it is? It is here. Where? Hypoglossal nerve in the hypoglossal canal. So you're telling nerve number 7, 8 in the internal auditory meatus. Yes. Nerve number 9, 10, 11 in the jugular foramen. Yes. But not the 12th. No. Why? Because 12th nerve is hypoglossal nerve in the hypoglossal canal. And what is in the foramen magnum? In the foramen magnum, you have the spinal accessory nerve coming from spinal cord. Now, when you say in the foramen magnum, you have spinal accessory nerve coming from spinal cord. Where is spinal cord? Spinal cord is not in the foramen magnum. It is below the foramen magnum. If you say spinal cord is below the foramen magnum, fine. What is there in the foramen magnum then? It is the lower part of the medulla oblongata. Lower part of medulla oblongata? Yes. Okay. You're telling lower part of medulla oblongata is in the foramen magnum? Yes. And it is not the spinal cord? No. So spinal cord is below the foramen magnum? Yes. It is the one which is giving the nerve here? Yes. It is the one. So this is spinal cord C125 giving spinal accessory nerve entering cranial cavity and exiting cranial cavity. It will enter and exit cranial cavity? Yes. What is the entry point? Entry point is the foramen magnum. Exit point is the jugular foramen. So you mean to say it is taking a U-turn inside the cranial cavity? Running inside cranial cavity for a short distance? Yes, actually. Spinal cord here below the foramen magnum is cervical 125 root value giving the spinal accessory nerve to enter the cranial cavity, passing the foramen magnum to enter cranial cavity, run a short distance, making a U-turn, exit the cranial cavity, passing jugular foramen, and then coming out of cranial cavity, supplying the two muscles, namely the sternomastoid and trapezius. What if sternomastoid is paralyzed? Because I have jugular foramen mass. If you have jugular foramen mass, then the 11th nerve is gone and two muscles are paralyzed. And if the sternomastoid is paralyzed, patient cannot turn the head to the opposite side. And also there will be difficulty shrugging the shoulder. Difficulty shrugging the shoulder. These are the problems. See, you had a case. What? It's a jugular foramen tumor. So, if there's a jugular foramen tumor, your patient will have difficulty shrugging the shoulder. Why? Because spinal accessory nerve compromised. And difficulty turning the head to opposite side. Okay, fine. What else is the problem? You know, nerve number 9, 10, 11 is also passing here. 9, 10, 11. Which part of 11? Cranial accessory nerve. Cranial accessory nerve. Yes. What about cranial accessory nerve? Do you remember one nucleus ambiguous? What about that? The number 9, 10, 11, cranial part of 11. Nucleus ambiguous gave you these nerves, and these nerves are passing through jugular foramen. So nucleus ambiguous, the number 9, 10, 11, cranial part of 11 gave you the number 9, 10, 11 passing the jugular foramen. Yes. For what? To supply the muscles of what? Palate, pharynx, larynx. And what if the muscles of palate, pharynx, larynx compromise? Difficulty speech and swallowing. That was our case. So our case was having difficulty speech and swallowing, but there was no problem with the tongue muscle. Why? Because tongue muscles are supplied by hypoglossal nerve, hypoglossal canal. It is not the jugular foramen. Can you tell me what else is passing in the foramen magnum? Yeah, in the foramen magnum I have medulla oblongata. Yes, what else? It is this spinal accessory nerve on each side. Yeah, spinal accessory nerve on each side. What else? It is two arteries. Which arteries? Vertebral artery on each side. If you say these are the vertebral arteries on each side, they enter the cranial cavity and unite to form the basilar artery inside cranial cavity. But they have to enter the cranial cavity passing the foramen magnum on the lower part of medulla oblongata. So vertebral artery pass foramen magnum, enter the cranial cavity at the lower part of medulla oblongata. Yes. Along with the spinal accessory nerve on each side. Yes. Do you know one thing? What? They're all surrounded by CSF. Why? They're all surrounded by CSF. They're all surrounded by CSF because this is the membrane. What membrane? Arachnoid meter. Oh, they're all in subarachnoid space. Yes, they are. They're all under arachnoid meter. So this is arachnoid meter and this is all under arachnoid meter. This is the CSF space. Yes. So artery, nerve or medulla oblongata are surrounded by CSF. Yes. Can you show me some diagram regarding that? Yes, let us see the diagrams which will tell us some more details. First of all, you should tell this is spinal cord here. Where? This is spinal cord here. Okay. The spinal cord is giving you some nerve, C125. What is C125? Spinal accessory nerve. Where is the nerve? You see the nerve is here entering the cranial cavity. How it is entering the cranial cavity? How it is entering the cranial cavity? It is entering the cranial cavity passing what is called as the foramen magnum. Foramen magnum. So it is passing the foramen magnum here. Yes. How will exit? Jugular foramen. Jugular foramen. It will actually take a U-turn now. This is U-turn of the nerve. Yes. And then it will be exiting. When you're telling it is exiting, it is going where? It is exiting and going to supply the sternomastoid and also trapezius. After supplying sternomastoid, it will supply the trapezius. You're telling this is spinal cord here. Yes. And given this blue color spinal accessory nerve. Yes. To enter the cranial cavity passing some foramen magnum, yes, and then take a U-turn, run a short distance in the cranial cavity, passing out through what is called as the jugular foramen, yes, and then it will go and supply two muscles, first it will supply sternomastoid and then supply trapezius, yes. If trapezius paralyzed, difficulty shrugging shoulder. If the sternomastoid paralyzed, difficulty turning head to one side. This is what we have discussed earlier. One more thing we have discussed, that was the content of foramen magnum. What about that? We have discussed that structures passing through foramen magnum are, yes, the lower part of medulla oblongata. Now, when you say it is the lower part of medulla oblongata, not the spinal cord, it was followed by some spinal accessory nerve. And what else was following? What else was following is the two vertebral arteries. And what else was following? Actually, all these things, the structures are deep to the arachnoid mater. If you say they're all deep to the arachnoid mater, means they are all surrounded by CSF, because that will be in the subarachnoid space. What is outside the arachnoid mater? That must be the dura mater. But actually, the point is that all these structures which we have discussed are under the arachnoid mater in the subarachnoid space. So is the tectorial membrane also in the subarachnoid space? Tectorial membrane is not. Tectorial membrane is passing foramen magnum, but it is outside the subarachnoid space. What is tectorial membrane, by the way? Tectorial membrane, it is entering the foramen magnum to attach to occipital bone. But if it is entering the foramen magnum attached to occipital bone, where it came from? Where it came from, yes, is the question. So you tell that this is vertebra, body of vertebra. This is vertebra, body of vertebra, yes. And then tell there is one ligament running anteriorly to body of vertebra, and there is one ligament running posteriorly to the body of vertebra. So one ligament run anteriorly, one run posteriorly. What is the name? Names are anterior longitudinal ligament and posterior longitudinal ligament. You are telling this is some vertebra body, yes, and in front of the body of vertebra there is some anterior longitudinal ligament, yes, and there is some posterior longitudinal ligament, yes. Now what? Now comes the skull. Skull, occipital bone, yes. But to reach occipital bone, you have an opening, foramen magnum. Yes, foramen magnum. See, what happens is, the posterior longitudinal ligament, what happens is, this posterior longitudinal ligament, yes, is passing foramen magnum to attach to occipital bone. Okay. Posterior longitudinal ligament will enter the foramen magnum to attach to occipital bone. That is tectorial membrane. Yes, tectorial membrane is a continuation of the posterior longitudinal ligament. That you remember. So tectorial membrane, membrana tectoria, is a continuation of the posterior longitudinal ligament to enter the foramen magnum attaching to the occipital bone there inside the cranial cavity. Yes, that is the point. Okay, I'll remember that. So there is the tectorial membrane, yes, passing through foramen magnum, yes, and then attaching to the occipital bone inside cranial cavity, yes. Continuation of posterior longitudinal ligament. Correct, that is what?